The head is naturally the most complex area. It not only contains the brain, it contains the eyes, the ears, nose, and throat. So there's several different specialties look after just parts of the head. Not to mention, of course, dentistry, which is a completely separate discipline. You go into the brain. The brain is broken into two specialties as such. One is the neurology and neurosurgeons, who tend to look after when the brain actually has something physically wrong with it, like a tumor or an infection, where they have to go in and operate or deal with it. Dementia, where the brain simply ages and atrophies, which is to shrivel up, unfortunately, as it gets older. And the psychiatrists tend to deal with the way the brain thinks, how it affects the way we function as human beings in an everyday world. The neurologists, as they will look after common conditions, meningitis, epilepsy, issues like dementia, Alzheimer's disease. And there's some overlap there because, of course, some of these conditions lead to depression. And this is a part of the way the brain thinks and works, and then the psychiatrist will become involved. Psychiatry has two main areas of two groups of diseases. It's got psychosis, where the mental illness is associated with the person not having any insight. Psycho killers, schizophrenics, where they have problems with the brain and they don't have any insight. And they're the most worrying and the most serious. And the neuroses, which is where we have a problem but we have an awareness. And the neuroses are classically broken down into the anxieties or phobias, depression and addiction. The anxieties and phobias, we can all get a little bit paranoid. Who's here? We can all get a little anxious. But when the anxiety or the paranoia leads you to stop living a normal life, then you've actually got a disease. So you can be a little neurotic, fine. If the neurosis leads you to the point where you cannot function, you need help. A depression, about 1 in 3 people will have a depressive illness during their life. There's a big difference between what we call reactive depression. That's where you've had a sudden loss, you have bereavement. It's quite natural to be depressed. You've had a miscarriage. It's understandable. Whereas other patients will have a problem where they simply, the way their brain works leads them to doubt themselves, to feel a lack of self-worth, and to simply become very low in themselves, despite the fact that their lives are actually quite good, and they need help. Addiction is best described as imagine you've got a little worm in your head. And that little worm, once it gets fed, it demands more and more and more. And it will play tricks with your mind to convince you that unless you feed that worm, you will not be happy. You can get everything from sweats to can be convinced that you can change the whole way you think, just so you'll engineer yourself into a position where you'll have whatever that little worm wants to feed on. And it always wants more and more. And that's the problem with addiction. Gambling, food, alcohol, nicotine, cigarettes, heroin, all of these things have the tendency or the ability in certain brains to become an addiction. And again, an addiction is a problem, or enjoying alcohol or whatever it is does not become a problem until it stops you being able to live and function a healthy, normal life. Then you've gone from enjoying a glass of wine to having an addiction problem or a dependency problem. And that's the majority of what psychiatry deals with. And as I said, neurosurgeons, which are the final part of that brain, tend to deal with neurological problems where it is felt that a surgical solution will help. For instance, if somebody has a slipped disc on their vertebra in the back, then they may need to have that disc repaired or those vertebrae fused together. In the old days, there was controversial crossover where sometimes the neurosurgeons would remove parts of the brain in an attempt to heal psychiatric illness, the frontal lobotomy, where they would take a frontal part of the brain. But more and more these days, the feeling is that surgery is not a particularly good solution for psychiatric conditions, and you need to have an actual physical problem before you get your neurosurgeon involved.